Okay, good afternoon, and thank you for joining the City of Philadelphia's briefing on the city's response to COVID-19. Today, all our speakers are joining virtually to adhere to social distancing guidelines. And we will begin our briefing with opening remarks from Mayor Kenny. Mayor, you have the floor.
Thanks, Mike, and good afternoon, everyone. As I'm sure you're aware, today marks the return of indoor dining here in Philadelphia. Some restaurants are choosing to offer this and others are not. I'm confident that those operators who do will do so by following the specific guidelines that the health department has laid out. I hope that this will, at least in some small way, begin to ease the economic impact of COVID-19 on our great restaurant industry. I know that the additional tips in the pockets of waitstaff and additional revenue to them will also be welcome. So remember to treat your waitstaff well and be polite to them. In support of local restaurants, starting today, the Philadelphia Parking Authority will offer discounted pricing at 6 of its Center City garages. From now until November 30th, patrons at participating restaurants will be provided a discounted $7 flat rate parking rate after 5 p.m. at 6 authority-operated garages in Center City. $7 flat rate discount will be valid for up to 4 hours after entering the garage. We thank the Parking Authority for their support of our restaurants as we continue with phased reopenings. I want to shift now to a very important topic. September is National Recovery Month, a time meant to increase awareness and understanding of substance use disorder and to celebrate the people who do recover. We know that people can and do recover from the disease of addiction. Those in recovery deserve to be celebrated, and those who are addicted need to see that it can happen. We have a network here in Philadelphia to help them with their struggle. Issues related to COVID-19 pandemic are greater than ever. Job, threat of eviction, isolation, fear of sickness or death, grief, and much more. In addition, we know many people are still facing the mental anguish associated with the horrific crimes committed against George Floyd, Breonna Taylor, Jacob Blake, Daniel Prude, and countless many others. The dangers of people developing substance abuse and addiction are greater than ever. In 2014, more than 47,000 people in the United States died of drug overdoses, more than double the number of fatal drug overdoses in 2000. In 2019, 1,150 people died from drug overdoses in Philadelphia, and over 80% of those overdose deaths involved opioids. 3 months after the stay-at-home order were issued, the face of the overdose death epidemic is changing in Philadelphia, with Black overdose victims surpassing white victims for the first time. Philadelphia is fighting back. We have a dedicated team of the Department of Behavioral Health and Intellectual Disability Services that works every day to educate, train, serve, and support. Their work saves Philadelphians' lives every day and makes a tangible difference in our city. Those struggling with substance abuse needs to know that they are never alone. If you need help, call the Community Behavioral Health Hotline at 888-545-2600 or visit cbhphilly.org to access addiction services, whether or not you have medical insurance. And remember that Recovery Month is also about raising awareness, but it also is about celebrating. The centerpiece of that celebration in Philadelphia is the annual Recovery Walk, which started almost 20 years ago with 100 people and has grown to about 30,000 participants in recent years. This year's walk will be virtual rather than the in-person event usually held at Penn's Landing and Old City. But I urge everyone to take part in the walk the morning of September 12th to help celebrate recovery and end the stigma surrounding substance use disorder. Visit recoverywalks.org for details of the walk and the other events throughout the month. Remember, people can and do recover from the disease of addiction, and Philadelphia is here to help. Now I'd like to turn it over to Dr. Farley for his update.
Thank you very much, Mayor. We are seeing similar case counts for the coronavirus infection last week compared to the week before, but perhaps some evidence that the outbreak at Temple is subsiding. Here are the numbers. Since this time yesterday, we've identified 43 additional cases of the coronavirus infection in Philadelphia residents, bringing this to a total of 34,741 since the beginning of the epidemic. Now, for the past week, the week that ended Saturday, September 5th, counting by the data which the test was run in the laboratory, we averaged 109 cases per day. Now, with case report delays, we'll likely see an increase in that number in the next few days. But right now, that number is similar to the 108 per day that we saw the week before. Also last week, that an average of 4.2% of the people who were tested positive. That's a slight increase from the week before. Fortunately, I can report today we've had no new deaths identified from the coronavirus infection. Our total since the beginning of the epidemic is 1,763. But remember that we get data on death in batches, and so we would expect to hear about more later this week. Where we are in testing, last week we tested about 2,600 people per day. We're still having a slow turnaround time in one laboratory, that is to say Quest, but there are more sites than ever where people can be tested. You can go to our website, www.phila.gov/testing, to see all the different sites where you can get tested and the details on how to access that site. Our mask use numbers are looking very good. Last week, more than 90% of people in retail stores that we observed were wearing masks. That number is definitely protective. It's something we're very pleased to see. I want to thank Philadelphia residents for taking this so seriously and learning how to wear masks. It's not that difficult, but everybody's really taking this up. It's great. What you're doing is saving lives. Now, I'll give you an update on our college-associated cases. Around the United States right now, we're continuing to see outbreaks in many colleges, and we're seeing case rates rise in several states, what appears to me to be related to this. Here in Philadelphia, the Temple University outbreak appears to be subsiding. Case counts appear to be falling in the past few days, and Temple University conducted testing over the weekend. They did about 150 students per day, and they saw a decreasing percentage of those students who tested positive each day. So far, there's no evidence of spread from the Temple University population to other populations in the city. It's a very good thing. I want to thank, again, Temple University for its very quick action to control this outbreak, and let's hope that the subsiding that we're seeing right now continues. However, I'm still very concerned about the spread, the potential spread at colleges here. Social gatherings appear to be the greatest risk. We continue to hear about parties that were reported to us by a number of students where there's at least one student who tested positive. Several of those parties were organized by fraternities and sororities. Even if these parties are relatively small, if people are not wearing masks and they're getting together indoors, they can set up very rapid spread. So we're asking all the colleges in the area to do whatever they can to prevent these situations. Now, as the mayor said, as of today, we're allowing restaurants to reopen for indoor dining and theaters to reopen with restrictions. And we're asking those organizations, the restaurants and the theaters, to follow the safety standards which are on our website. The key points are this: for restaurants, for indoor dining, no more than 25% capacity. Okay, so there's lots of space between diners. The diners have to be more than 6 feet apart from each other and different tables. Everyone in the restaurant needs to wear masks except when they're seated at tables eating. There's no bar service and no alcohol served except as part of a meal. And the staff must wear masks as well as face shields. The theaters, there's a limit to 25 people inside, and there's no food or drink allowed to be served. Now, unless these precautions are taken, these are high-risk situations. That's why we have these precautions. So we will take these standards very seriously. We are sending staff to restaurants to educate them about the standards. And we're also having our inspectors check the COVID safety precautions as part of their routine inspections. If Philadelphia residents see restaurants or theaters that are not following these standards, we ask everyone to call 311 and let us know. We will send inspectors out to verify and educate, and if necessary, we will close places down if they're out of compliance. As you may have heard this morning, the governor announced that he will allow expansion of restaurants from 25% capacity to 50% of capacity effective on September 21st. This just happened this morning. We will review the governor's policy change and consider what we'll do here in Philadelphia. But the restaurants in Philadelphia should not assume that we will just follow the governor's policy change here in the city. As the city that was hit hardest by this epidemic, we have been more restrictive in the state in a number of areas in the past. And we will continue to be more restrictive if we feel it is necessary to protect Philadelphia residents. Now, I know all these safety precautions are difficult. I know it's difficult to maintain these, but we need to continue to limit how we get together to avoid getting more cases and more deaths. So the advice to everyone is avoid gatherings, wear a mask when you're near others, and that includes when you're near your relatives and includes when you're near your friends. Avoid gatherings even when you're talking about gatherings with your relatives and your friends. This is especially important for people over the age of 65 or people with chronic medical conditions. More information on everything on our epidemic is at our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And now we go to Armando for the Spanish language translations of the mayor's and Dr. Farley's comments.
Palabras del alcalde Jim Kenney para el día 8 de septiembre del 2020. Buenas tardes. El día de hoy se reanuda el servicio de comidas en el interior de los restaurantes en Filadelfia. Algunos restaurantes han elegido ofrecer esta opción y otros no. Estoy seguro de que los operadores que han decidido reanudar este servicio lo harán de acuerdo a las pautas específicas que ha establecido nuestro Departamento de Salud. Espero que esto, al menos en pequeña medida, alivie el impacto económico del COVID-19 para nuestra gran industria gastronómica. Sé que las propinas adicionales en los bolsillos de los meseros serán bienvenidas. Este ingreso es necesario para ellos y para sus familias. Por lo tanto, recuerde darle una buena propina a su mesero porque se lo merece. En apoyo a los restaurantes locales, a partir del día de hoy, la Autoridad de Estacionamiento de Filadelfia ofrecerá precios con descuento en 6 de sus garajes en el centro de la ciudad. Desde ahora hasta el 30 de noviembre, los clientes de los restaurantes participantes recibirán una tarifa de estacionamiento plana de $7 con descuento después de las 5 de la tarde en 6 garajes operados por la PPA en el centro de la ciudad. El descuento de la tarifa plana de $7 será válido hasta por 4 horas después de ingresar al garaje. Le agradecemos a la PPA por su apoyo y a nuestros restaurantes mientras continuamos con la reapertura por etapas. Ahora quiero pasar a un tema muy importante. Septiembre es el mes nacional de la recuperación contra las adicciones, un momento destinado a aumentar la conciencia y la comprensión de los trastornos por el uso de sustancias y celebrar a las personas que se están recuperando. Sabemos que la gente puede rehabilitarse y se recupera de las adicciones. Las personas que se están recuperando, por lo tanto, merecen ser celebradas. Y aquellos que son adictos necesitan ver que hay una luz al final del túnel y que también ellos pueden recuperarse. Tenemos aquí en Filadelfia mucha ayuda para ayudarlos en su lucha. Este año, las dificultades relacionadas con la pandemia del COVID-19 son mayores que nunca. La pérdida de empleo, la amenaza de desalojo, el aislamiento, el miedo a enfermarse o a morir, el dolor y muchas otras cosas más. Además, sabemos que muchas personas todavía enfrentan la angustia mental asociada con los horribles crímenes cometidos contra George Floyd, Breonna Taylor, Jacob Blake, Daniel Prude y muchos otros. El riesgo de que las personas desarrollen adicción y abuso de sustancias es entonces mayor que nunca. En el 2014, más de 47,000 personas en los Estados Unidos murieron por sobredosis de drogas, más del doble de la cantidad de sobredosis fatales por drogas en el año 2000. En el 2019, 1,150 personas murieron por sobredosis de drogas en Filadelfia, y más del 80% de estas muertes por sobredosis involucraron los opioides. En los 3 meses posteriores a la emisión de las órdenes de quedarse en casa, el rostro de la epidemia de muerte por sobredosis está cambiando en Filadelfia. Las víctimas por sobredosis, que son afroamericanas, superan a la cantidad de víctimas blancas por primera vez. Pero Filadelfia está contraatacando. Contamos con un equipo dedicado en el Departamento de Salud del Comportamiento y Servicios para Discapacidades Intelectuales que trabaja todos los días para educar, capacitar, servir y apoyar. Su trabajo salva vidas en Filadelfia todos los días y marca una diferencia tangible en nuestra ciudad. Aquellos que luchan contra el uso de sustancias deben saber que nunca están solos en Filadelfia. Si usted necesita ayuda, llame a la línea directa del Community Behavioral Health al 888-545-2600 o visite cbhphilly.org para acceder a los servicios para combatir la adicción, tenga o no tenga usted seguro médico. Y recuerde que el mes de la recuperación contra la adicción se trata de concientizar, pero también de celebrar. La piedra angular de esta celebración en Filadelfia es la caminata anual de recuperación que comenzó hace casi ya 20 años con 100 personas y ha crecido contando con cerca de 30,000 participantes en los últimos años. La caminata de este año será virtual, en lugar del evento presencial que generalmente se llevaba a cabo en Penn's Landing y Old City. Pero insto a todos a participar en la caminata de la mañana del 12 de septiembre para ayudar a celebrar la recuperación y terminar con el estigma asociado a los trastornos por el uso de estupefacientes. Visite recoverywalks.org para obtener detalles sobre la caminata y de otros eventos durante el mes. Recuerde, la gente puede recuperarse de la enfermedad de la adicción. Y Filadelfia está aquí para ayudarlo. Gracias. Y esta es la actualización en materia de salud para el día 8 de septiembre del 2020. El recuento de casos mantiene números similares a los que hemos visto y tal vez esto sea evidencia de que el brote en la Universidad de Temple está disminuyendo. El día de hoy reportamos 43 nuevos casos con un total de 34.741 casos reportados en total. La semana pasada, que acabó el sábado 5 de septiembre, tuvimos 100 nuevos casos diarios en promedio, muy similar a los 108 casos diarios en promedio reportados la semana anterior. El porcentaje de casos positivos fue de 4,2% la semana pasada. Esto representa un ligero incremento con respecto a la semana anterior. El día de hoy, felizmente, no reportamos muertes por el COVID-19. En total, 1.763 personas han fallecido en Filadelfia a consecuencia de este virus. Nosotros estamos recibiendo esta información por grupos, así que esperamos poder anunciar más fallecimientos esta semana, lamentablemente. Sobre las pruebas, la semana pasada realizamos aproximadamente 2.600 pruebas diarias. Todavía los tiempos de respuesta de uno de los laboratorios grandes sigue siendo demasiado lento. Los centros de prueba pueden ser ubicados en fila.gov/testing. Los números respecto al uso de las máscaras son, sin embargo, muy buenos. La semana pasada observamos un 90% de su cumplimiento en las tiendas. Las personas están usando proactivamente sus mascarillas. Sobre el aumento de casos asociado con el reinicio de clases en las universidades, continuamos viendo brotes en muchas universidades del país. El brote en la Universidad de Temple parece haber sido estabilizado, sin embargo. El conteo de casos se ha estabilizado o ha disminuido en los últimos días. La Universidad de Temple realizó pruebas a los estudiantes durante este fin de semana. 150 estudiantes aproximadamente fueron examinados y la tasa de positividad está disminuyendo. Hasta ahora, no hay evidencia de que se esté propagando la enfermedad a otras poblaciones. Sin embargo, seguimos muy preocupados sobre la propagación en las universidades locales. La mayoría de los infectados lo hicieron en reuniones sociales informadas por varios estudiantes que dieron positivo. Varias de estas reuniones fueron organizadas por las fraternidades y las hermandades. Incluso si es relativamente pequeña la reunión, esto puede provocar una propagación muy rápida del virus. Le pedimos a todas las universidades del área que hagan todo lo posible para prevenir estas situaciones. Hoy, los restaurantes pueden volver a ofrecer servicio en interiores y los teatros también podrán volver a abrir. Les pedimos a todos observar las precauciones de seguridad que pueden ser ubicadas en nuestro sitio web. Con respecto al servicio en interiores, este servicio debe ser al 25% de capacidad del establecimiento. Los comensales deben estar a 6 pies de distancia de los otros. Los comensales deben usar mascarillas excepto cuando estén sentados en las mesas. No habrá servicio de bar y no se servirá alcohol excepto como parte de una comida. El personal que labora en un restaurante debe de utilizar mascarillas y protectores faciales. Los teatros no podrán servir comidas. Y a menos que se tomen precauciones debidas, esta todavía es una situación de alto riesgo. Nosotros estamos tomando en serio estas recomendaciones. Enviaremos personal para educar a las personas que trabajan en los restaurantes. También enviaremos inspectores para monitorear las precauciones del COVID-19 como parte de su trabajo. Si las personas ven que los restaurantes o teatros no están siguiendo estas recomendaciones, deben reportarlos al 311. Nosotros cerraremos rápidamente aquellos lugares que no cumplan con las reglas. El gobernador Wolf permitirá la expansión del servicio en el interior de los restaurantes al 50% a partir del 21 de septiembre. Nosotros estamos revisando esta decisión y la consideraremos, pero los restaurantes no deben asumir que nosotros adoptaremos esta directriz. Ya que Filadelfia fue la ciudad más afectada por esta epidemia, hemos sido más restrictivos que el resto del estado y continuaremos siéndolo si creemos que es lo necesario para proteger a los residentes de Filadelfia. Sabemos que es difícil mantener las precauciones de seguridad, pero necesitamos limitar la forma en la cual nos reunimos para evitar muertes y más casos. Por ello, la recomendación sigue siendo de evitar reuniones sociales de cualquier tamaño. El utilizar una mascarilla cuando esté cerca de otros. Y esto es especialmente importante para las personas mayores de 65 años o aquellos que tienen condiciones médicas preexistentes. Juntos podremos enfrentar esta pandemia y lo haremos. Muchas gracias.
Great. Thank you, Armando. We're now going to move to the Q&A portion. Thank you for joining the press briefing on topics related to the COVID-19 pandemic. Also joining us today is Acting Managing Director Tumar Alexander. The first round of questions is limited to COVID-19, and that would include matters related to indoor dining, to the access centers, and to National Recovery Month, of which the Joining us today for questions on access centers is Deputy Mayor Cynthia Figueroa. Joining us for any questions on National Recovery Month is Roland Lamb, who is Deputy Commissioner for the Department of Behavioral Health and Intellectual Disability Services. Now, if you have questions on any other topics, including the encampments on the Parkway and Ridge Avenue, please hold them to the second round of questions. And joining us today for questions on the encampments is Deputy Managing Director Eva Gladstein. If your hand is raised now and your question is not on COVID-19, access centers, or recovery, please lower it and we will announce the second round when we get to it. And as usual, one representative from each outlet is permitted to ask questions, and we ask that reporters limit their questions to 3 or fewer. And with that, we move first to Rosemary Connors of NBC 10.
Thanks, Mike. My questions are actually about the access centers. My first one is, what is the role of the staff at the access centers? Are these rec center staff members?
So Rosemary, this Cynthia. So we have 2 different sets of staff. We have the rec center employees that help open the buildings, check the children in, and are supporting safety guidance at the sites. And then we have partnered with our out of school time providers who are providing the oversight of kids in the actual space and also helping with some of the enrichment activities. So it's a combination of city employees as well as some of our contracted providers.
Got it. Thanks, Deputy Commissioner. And then my other question on access centers, can families still apply, or have you reached capacity? Are you anticipating reaching capacity?
So there are still some slots available. We have reached capacity in the first phase. We've been able to reach a total number of about 1,700 families, and we've been able to register are eligible. And of that, we've been able to register just over 600 families. We think we'll be at capacity by the end of this week. And then the second phase begins September 21st. So there is still the ability to enroll online.
Got it. And then my last question is for the mayor, and I believe this is COVID related, but obviously Mike or the mayor stop me if it's not. It's about MLK Drive. Obviously it's been shut down as less traffic, less people going to work because of COVID, working from home. Any plans to reopen MLK Drive? Is that anywhere in sort of the COVID-19 planning?
It may be in conversation between departments. It's not risen to me. I don't know if Tumar has any insight or information on the drive.
Hey, good afternoon. It hasn't risen to my level either. We'll check, Rosemary, and get back to you about it.
Okay, great. Thanks, guys.
Great. Thank you, Rosemary. And let's move now to Lawrence McGlynn, of WPPM.
Thank you. Dr. Farley, how concerned are you that clearing of the encampments on the Parkway and Ridge Avenue and dispersing of its residents could lead to spreading the coronavirus, considering CDC guidance recommends against clearing encampments?
Lawrence, do you mind? I'm sorry, I had earlier indicated that we wanted to hold encampment questions, and we realize there are probably a number to later, even if your question is specific to Dr. Farley. We want to focus, and we'll get back to you, Lawrence, okay? So if you don't mind, let's move on to David Merrill of Philadelphia Magazine for the moment.
Hi, yeah, this is for Dr. Farley. You alluded to declining case numbers at Temple over the weekend. Can you share specific numbers about the number of cases and the positivity rate there? And then also wondering, given that there is often a time lag for when new cases start to show up, how confident are you that Temple's outbreak still might not later spread to the surrounding community?
Yes, the numbers we have on the number tested, the number positive we have from Temple, and so I prefer you to go to them to get the original source there so we don't misreport that information. As to the second part of your question, all I can say is that the numbers appear to be subsiding over the past few days. I definitely am not saying that this outbreak is over. There could be an increase from here. So we're pleased to see the numbers where they're going right now, but I'm not going to say for sure that this is over.
Thanks. And second question also for you, Dr. Farley. I mean, having seen what happened at Temple and what has been happening across the country in college towns, effectively, where there have basically been in numerous cases sort of instant outbreaks upon return of students to campus. Do you think it was a mistake for the health department to sign off on Temple's plan to bring students back to campus this fall?
I don't think so. I would say that we underestimated the risk of the students who were off campus and out of the control of the university, and how quickly we could get an outbreak occurring in that population. Still, it appears that there was a relatively small fraction of the total number of students that were involved in this, and it does. We're optimistic right now that the numbers appear to be subsiding. So I think it was the appropriate thing to do at the time. I think that Temple made the appropriate decision to go to all online in the wake of this. And we are in close communication with the other colleges around the city now that we recognize this risk about taking extra precautions. We want to be as close as possible to normal operations here. And if we can do things safely, we want to try to do that.
Great. That's all I had. Thanks.
Thank you, David. Let's go now to Shira Arias of Telemundo.
Good afternoon. I have two questions. One is for Dr. Farley, and the other one, I guess, could be for the city just in general. So, Armando, quiero que le preguntes al doctor Farley cómo él va a lidiar con los casos que se registraron, que se van a registrar o que van a surgir después de este fin de semana largo. O sea, ¿cuándo van a salir esos números y de qué manera esos números pueden impactar la apertura, un 25% de indoor dining? ¿Me escucha, Armando?
Armando, you need to unmute yourself.
Yes, sorry. Dr. Farley, the question is for you. She's asking how the city intends to deal with the uprise in cases after this long weekend, and if this is going to affect the opening of restaurants.
Restaurants are still allowed to reopen as of today to indoor dining with restrictions. And although we did see an increase in case counts in the early part of last week, the numbers were falling over the latter part of last week. So that has not changed our plans.
Los restaurantes están autorizados a abrir, obviamente, con las restricciones que se están imponiendo para servicio en interiores. Y aunque hemos visto un aumento en las cifras en la semana anterior, este aumento no es significativo, por lo tanto, continúan abriendo los restaurantes.
That being said, then, ¿cuál sería el aumento que impactaría que los restaurantes tuvieran que volver a cerrar? ¿Qué tipo de aumento se tendría que registrar? Pregúntale eso.
Dr. Farley, the question now is the follow-up. What would be the numbers that would justify closing up restaurants again?
We haven't put a number on it. I would say if we see a sharp rise in the case counts or a sharp rise in the percent positive, that we would consider, and evidence that dining at restaurants was related to that we would consider closing restaurants. But we haven't set a specific number on that.
Nosotros no hemos considerado una cifra específica para llegar a esa decisión, pero si viéramos un aumento súbito en el número de casos o la tasa porcentual de positividad en los casos como prueba de que esto se esté originando en restaurantes, pudiéramos hacerlo, pero por el momento no estamos contemplando hacerlo.
And then finally, if you could ask the city si ellos tienen un conocimiento de cuántos restaurantes han tenido que cerrar tras la pandemia, aproximadamente.
This is a question in general for the city, if there is the knowledge of the number of restaurants that have had to close due to the pandemic.
I don't have it.
No contamos con esa cifra en estos momentos.
I mean, we can try to get it. I mean, is she talking about close? Well, everybody had to close.
No.
Estamos hablando de que todos tuvieron que cerrar, pero me imagino, Shaira, que te estás refiriendo a los que cerraron para no volver a abrir, ¿verdad?
Exacto, yes. That had to permanently close because they were so impacted economically.
We don't have that. Well, at this point, I don't know if we have that number yet because we just started to reopen. So we don't know who's going to reopen, who isn't. There are restaurants that have the capacity to reopen indoors that have told me personally they're not going to do it until the weather starts to turn colder because They want to stay out. They want to stay outdoors, and then as it gets colder, see how the numbers are going and open up indoors. So I don't know if we have a definitive number of restaurants that have ceased to exist until we have another month or so of open and indoor dining.
If I could add to that, I don't think we're going to ever know that number because the restaurant industry, restaurant business is always high risk. There are restaurants that close all the time because they simply fail to make it as a business. And it's not going to be possible to say that this one failed because of COVID versus this one failed just because they couldn't make a living at that location given the service they do. So we're not going to be able to give you a number on that.
No contamos con estos números todavía, nos dice el alcalde. Los restaurantes, y yo he hablado con propietarios de algunos, están escogiendo no abrir todavía hasta que no cambie el clima para servir en interiores. Por el momento, hasta los últimos meses, el servicio solamente ha sido en exteriores, pero con el frío, ellos quieren ver qué es lo que va a pasar y probablemente en un mes se pueda tener mayor información, pero va a ser muy difícil de saber cuáles de estos restaurantes están cesando sus operaciones en general. Y el Dr. Farley nos indica de que tal vez nunca podremos saber cuál es la razón por la cual un restaurante dejó de operar, porque es un negocio de alto riesgo que implica a veces dificultades que no tienen que ver con la pandemia. Entonces no va a ser posible saber si un restaurante dejó de operar por los efectos de la pandemia o por las dificultades inherentes a manejar un restaurante en una ciudad como la nuestra. Gracias.
Thank you.
All right, thank you, Shira. Let's go now to Laura McChrystal of the Inquirer.
Hi. First, I have a question for Mayor Kenny. Do you plan to dine indoors this week? And if so, where?
That would be like being a judge in a baby contest. So I'm not going to make a choice on where I want to go first. But I want to make sure it's clear that even during the closure, I mean, I've dined myself and our office has ordered takeout from various restaurants for lunch. And we've tried to support the restaurant industry as much as possible. And prior to the pandemic, obviously I'm a little heavier than I used to be before I went into public office. So I've been taking care of restaurants before the pandemic. So I have no particular place in mind. And I'm unlikely to tell you because you'll follow me there.
But you do plan to go somewhere.
Yeah, I've been going to restaurants since before the indoor dining was stopped. Since outdoor dining was allowed, I've been patronizing restaurants in Center City and in my neighborhood, and
Okay, thanks. And I also have a question for Dr. Farley. With more reopening and colleges reopened, are you hopeful that the city, like it sounds like in the last 2 weeks, cases were about the same. Are you hopeful that we'll continue to see a decrease even as you see more reopening, or are we likely to plateau at some point?
It's really very difficult to predict. I can't say whether we're going to see increases because of more things reopening or because in the fall season, most respiratory viruses get worse, or we'll see a decrease because people have learned how to deal with this epidemic and they're wearing masks. It could go either way.
Okay, thanks.
Thank you, Laura. We are going to go now to Manny Smith of CBS 3.
One question for Dr. Farley, and it relates to Temple University. I know you guys had talked about the risk of community spread, not really evidencing itself with people moving off campus, but what's your recommendation to students who are on campus now? Should they stay there or should they go home? Is there concern about students who may make the option to go home in the next few weeks?
We are encouraging students to go home rather than having a large number of people off campus here in the city. However, that needs to be done very carefully. And we've given very specific guidance to Temple to disseminate to its students about how to do that so that they don't bring the infection home with them and pass it on to their parents. That they can get, depending on the situation, the student could get tested or the student could quarantine before they go home. But over the longer term, we do think it's safer if those students, they don't need to be in Philadelphia if they were to go home.
All right, thank you very much.
Thanks, Manny. We're going to go to Martin Pratt of Philly YBN.
Thank you. Dr. Farley, how does Temple's numbers stack up to Drexel and Penn's numbers and University of Science?
Are you talking about numbers of students or number of positive cases?
Number of positive cases.
We've had, I'm not aware of positive cases at Penn or Drexel, but again, we have difficulty identifying whether a case is a student. We know that the name of the person who has a positive test, but they don't have their student label on them. And so with Temple, we heard anecdotally about a number of cases, and so we made real efforts to identify those students who were Temple associated.
What steps have the city or Department of Health explained to Temple that they must take in respects to driving these numbers down, that unequivocally that you're not going to allow?
Well, we each university, including Temple, had a safety plan which we worked with them on and said you need to do things. For example, they need to be wearing masks in class. They need to be keeping a distance, minimize the number of students in class. They need to put a space between students in the cafeteria. That included many features also about the on-campus residential sites, the dormitories. The problem that we saw here was that students who were off campus that were not in any area that the university controlled. And so there was nothing we could require Temple to do. We said, do what you can to try to discourage social gatherings amongst those who are off campus. And they did what they could, but they were not able to prevent all those social gatherings. So there's a limit to what we can require. And as we saw, with a very large number of students living off campus, that just became too high risk a situation.
Lastly, the governor issued that statement. I'm not sure if you addressed it in your opening words or not, but he issued that the 50% occupancy is what Pennsylvania can allow restaurants. Will the city be following that recommendation or staying at 25%?
Yeah, I did mention that in my opening comments, and I said that we'll review it. It just came out today, but the restaurants should not assume that we're going to go to that. We have been more restrictive than the rest of the state in the past because we're the highest risk city. And if we think it's appropriate for us to be more restrictive, we'll continue to be that way.
Okay, thank you.
Thank you, Martin. Let's go to Denise Clay of the Philadelphia Sun.
Good afternoon, everyone. And I'd like to direct my questions to both the mayor and Dr. Farley. What part, if any, did the advent of Restaurant Week play in the decision to open restaurants to indoor dining this week? And will Restaurant Week be something that you monitor? Is there any special monitoring you're going to be doing as part of Restaurant Week?
So,
there was nothing from my perspective on Restaurant Week. We had, I think, decided on the 8th because it was after Labor Day weekend, which would have been potentially a situation where lots of people would have been congregating in lots of places indoors. So we thought that the 8th was more prudent, but Doctor can speak for his analysis.
That is the answer.
Oh, wow. I got smart.
Okay. Also, when it comes to things like Restaurant Week, is there like because it's such a bigger event over and above what we normally do in terms of indoor dining, are there any plans to have, like, say if you see something that really, really freaks you out, like a special number you can call other than just 311? Because sometimes I was out and about last weekend and I saw a group of outdoor diners on 17th Street that weren't necessarily socially distancing. So I'm wondering, is there anything that's going to be put in place to kind of keep a tighter eye on Restaurant Week now that you can go indoors?
The best thing for people to do is to have it route those calls through the regular route. Call 311. We're prepared for that. And so if we hear of anything that's unsafe, we'll send an inspector out there.
Okay. Also, I have one more question, and I think I'm going to have to go with the mayor with this because I don't see anyone from SEPTA here. One of my sources reached out to me and asked about mask wearing requirements on SEPTA. This person takes the bus a lot. They have pre-existing conditions, and what they're noticing is that in some cases the bus drivers aren't wearing masks. and expand
Denise,
capacity.
that is in fact a question for SEPTA. You could reach out to their media relations department. I'm sure they can clarify that it's not be appropriate to speak on that. But thank you, Denise.
You're welcome.
And with that, we will now move to a second round. Let's go back to Lawrence McGlynn. There you go. Lawrence, you had a question regarding the encampments. Thank you for your patience.
Yes, Dr. Farley, how concerned are you that the clearing of the encampments on the Parkway and Ridge Avenue and the dispersing of its residents could lead to spreading the coronavirus, considering the CDC guidance recommends against clearing encampments?
Well, first, I should clarify, if you look closely at the CDC guidance, they don't just say don't clear encampments. They say take into account the totality of the risk of the situation, that there are other health risks besides COVID of a group of people living outside, perhaps in poor sanitation, or they could transmit other diseases or have other health problems. But we're concerned whenever people get together, there's a risk of COVID spread. But with homeless people, there's a risk, a variety of risks. Right now, the shelters, we're seeing no cases essentially in the homeless shelters. So I'm not particularly concerned that there's going to be an increased risk of COVID for them if they go from the encampment to a shelter.
Are there any special plans to help mitigate the risk amongst those being dispersed from the encampments?
The shelters already have a variety of steps in place in order to prevent spread in those facilities, including social distancing and masking and testing where appropriate. And those are going to be applied to anybody who goes into a shelter.
If I could jump in as well, and for people who are particularly vulnerable, that is over the age of 65 or with underlying medical conditions, we have space available at our COVID prevention sites. And over 30 individuals who were staying at one of the other of the camps have already gone to those sites, and we have additional room. So individuals in that situation who are particularly vulnerable can go to there.
And there's nothing we would like more than everyone that's at that encampment to voluntarily decamp, and we'll find them a place safe to be. And that's what we've been trying to do for the past, 3 months now, is been trying to engage folks, let them know what services are available to them, try to ease their mind that we're not taking them we didn't take them somewhere bad. We put people in hotels, we put people in drug treatment, we put people into housing, into shelter, and we want to do it with everybody. And that's what we've been about since the beginning of this. But we've gotten to a point where it's just untenable to have this other health issues surrounding people living outdoors, defecating outdoors, using drugs outdoors, in an environment that has created this situation. We've negotiated, we've interacted, we've put forward proposals, we've responded to proposals, and it just goes back and forth. But anyone who's in there now who would like to come out, we're there waiting for them with open arms to transport them to a safe place.
Thank you. Lawrence, did you have anything further? Lawrence McGlynn, you're still muted.
No, that's fine. Thank you.
Okay, great. Thank you. And let's go now to Jack Tomzik of Metro.
Hi, this is also about the encampment. So will those campsites be cleared sometime tomorrow?
We're approaching tomorrow morning, as we've approached the rest of the past 3 months, dealing with the encampment to try to get people out of the encampment into shelter. And I'm not going to figure out what's going to happen the day after that, but we need to get people indoors where they're safe, and they're not safe outdoors.
So it's the same approach.
Eva, did you want to add on the approach tomorrow?
Sure. We're going to do what we've been doing, as the mayor said, for the last 3 months. We've had something called Homeless Connect. Close to 130 people have come in already, and we're doing that tomorrow and enhancing it with additional services and supports, including members of the clergy who will join us tomorrow. Folks are out there today as well. They've been out there 2 or 3 days a week for the last 4 months, and many individuals have found appropriate housing and other services. And we're really, as the mayor said, encouraging people to take us up on those offers today and tomorrow.
So there won't be a forcible removal of the campsites.
I just define forcible. I mean, we're going there every day with services available to entice people to come out of the camp to go into a safe place. So we will continue doing that until we can't do it anymore.
All right. Thank you.
Thank you, Jack. Let's go to Laura McChrystal. Let's go back to Laura. You're up.
Hi, I also have a couple questions following up on those asked about the encampment. Eva, you mentioned that today and tomorrow there will still be outreach. At what point does that type of outreach reach its limit and you have to try something else to clear people out of there?
I don't know the answer to that. We'll be out there as long as there are people there who want to connect to services and housing. We've been out there generally 4 or 5 hours a day, 2 or 3 days a week, and including today and tomorrow as well.
Okay, but with the posting of, the warning that it would be cleared, is there a different tactic that could be coming soon?
I'm not going to speculate on what may come. We're working day by day to get as many people out of the encampment and into safe shelter as possible, which is what we've been doing for the past 3 months.
Okay, and that's all. That's fine.
Great. Thank you, Laura. Let's go to Manny Smith of CBS 3.
We completely understand that you guys have been working on this for a while. We've been covering you step by step. But I think we're just looking for an answer of what we tell residents and other interested parties who said, hey, this is the third time around that the homeless encampment has gotten a notice. And it says 9 a.m. tomorrow. What will happen or what won't happen? And again, what do we tell the residents today at 4, 5, and 6?
We've been in touch directly with residents and residents groups, representative groups, and we will continue this effort until it doesn't work anymore. I don't know when that's going to be.
So today, it sounds like the residents this afternoon are going to have a barbecue and another celebration there. Again, does not sound like they want to leave and are just not negotiating and also not seem like they want to follow that order. What do you say to that? That doesn't sound like people who are trying to cooperate.
I don't know what to speculate about what they're actually thinking or why they're doing this all. But that would be something for them to comment on, not me.
And then Manny, just to add, I mean, we certainly want to be out there to be able to have folks take advantage of all of these services that Eva just described and offer, no matter when that is or what type of activities they're doing. Like the mayor said, we've been doing that for the past 3 months. We're going to continue to do that. We're going to do it in a more visible way tomorrow, also being joined possibly by some clergy volunteers that want to join us, who've offered to join us and also participate in that. So.
All right, thank you. And should we expect like a briefing or a formal update on activities tomorrow, sometime after 9, or?
Manny, we would not forget you. We will make sure that we keep you updated. Precise timing is to be determined based on how things are going. Let's go now back to Denise Clay of the Philadelphia Sun.
Okay, I have a question regarding the capacity of the shelters and the current COVID-19 safe sites. Does anyone know if those places are close to or at capacity? What is the capacity for these places so that if these folks do come out of the encampment, they have somewhere safe and comfortable to go?
Denise, we have space at the COVID prevention sites, and we have about 200 beds available in shelter facilities, and it changes every day, so I can't give you an exact number, and we have the capacity to add beds if necessary. Okay. We also have space in recovery houses, and we also have space in residential treatment centers of various types.
All right, thank you.
You're welcome.
Thank you, Denise. Let's go back to Martin Pratt.
Yes. So question is about trash. I was reading the statement, and is it the recycling is a day after the regular trash pickup, or are you saying in the statement that both will be picked up one day after the regular trash pickup?
Well, there was a holiday yesterday, Martin, so we're a day behind because of the holiday and because employees being off.
And that's
so
normal.
We're actually continuing and being on time for services just like last week, just with the holiday being yesterday. So a day delay.
Thank you.
All right, thank you, Martin. Let's go to Lauren Make of NBC 10.
Hello.
Lauren, hi.
Yep. Am I unmuted? You can
You're
hear
good.
me?
You're good.
Okay. I know we've been talking a lot about the encampment. My question, though, is sort of about the larger housing issue and concerns about evictions. The governor today was urging the legislature to move on an eviction moratorium, at least from House Republicans. It doesn't appear that that is going to happen anytime soon. So in the city, what else can be done in the city to prevent evictions and having more people in need of housing?
Well, I can start with a response. The city set up on August 31st an eviction diversion program, which allows, before a landlord is able to file for a court action, a process of mediation to try to avoid the eviction hearing and frankly, the cost for the landlords. But in addition, City Council and the mayor approved a series of 5 different bills, including eviction diversion, called the Emergency Housing Protection Act. And so there are a number of other provisions in that in terms of stopping late fees, the timing for repayment agreements, and other kinds of supports. The city also has an eviction prevention program, which provides attorneys in the court on the day of a hearing so that tenants who are unrepresented can get that support that day. We are waiting to see what the local courts do in terms of enforcement of the CDC moratorium on evictions, which was announced last week, but we're still waiting to hear formally from the courts as to how they're going to handle that.
The diversion program in the city that you mentioned, how much time would that buy someone?
It depends, but what it does say is that before the landlord can file the eviction filing for the court hearing, they have to request a mediation process, and it's incumbent upon us to schedule that within 30 days. But the number of times they can meet to discuss is, not limited. But the first mediation conference would have to occur within 30 days of the landlord filing.
Thank you.
You're welcome.
Thank you, Lauren. Let's go to Pat Loeb of KYW. Pat, you're up. We're not hearing you. You are unmuted, but we're not hearing you, Pat. If you want to look at your controls, see if there's anything you change. All right, this is the last call for questions. Did anyone else have any further questions? All right, Pat, unfortunately, we're going to end the avail. I'm not hearing you at all. Okay, sorry. Please shoot us an email. We'll try to get you an answer. And with that, thank you, everyone. This brings to a close today's avail on COVID-19. And we will resume this on Thursday at 1 p.m.